Ladies and gentlemen, dear friends and colleagues, we all know that it is better to prevent than to treat. The question that arises from this is how can we prevent life-threatening diseases with a high prevalence at local, national, and international levels? One of these diseases is cancer, and a response to this question during the last decades comes also from the side of the civil society. An initiative from civil society from my native country, Greece, is the so-called Cancer Prevention Research Group in Greece, which I'm glad to present to you today during the Beyond Science Initiative International Conference. My name is Christos Tsagkaris. I'm a medical doctor from Greece, and I'm currently serving as the fourth vice president of the organization focusing on interdisciplinarity, outreach, and academic partnerships. The main goal of the organization is to contribute to local, national, and global collaboration against cancer. Some more specific objectives within this goal are the study of cancer prevention through a multidisciplinary lens, the contribution to scientific research and scholarship to the extent that our means as young scientists and members of the civil society provide us, the enforcement of community enhancement of community health promotion in our country and to the extent possible internationally, the voluntary support of patients and their families by young scientists and professionals, mainly members of the organizations, but also external collaborators, and of course the academic partnership and outreach in the field of cancer. Currently, we have more than 700 members hailing from more than 70 countries. You can see here the countries from where people have joined. Some of them have joined for research, some of them have joined to learn, others have joined in order to participate to social activities. And this is the way that membership expands from mouth to mouth and from activity to activity. What is important is that this is a youth-centered action, and this is reflected by the fact that the average age of our members is 25 years. The same, of course, applies to the board members, which have the same age average. And to put more significance in this, the organization was officially initiated and founded during the European Year of the Youth, which was a European initiative to show what can young people offer to genuine solutions of global problems such as cancer. Our members' knowledge and experience comes from more than 25 disciplines, ranging from medicine to sociology, mathematics and statistics, psychology and nutrition, and this is why we always call upon interdisciplinarity in our approach. This means that research fields in which our members are involved and from which they are trying to bring experience and insights into the organization range from basic and clinical oncology research to health promotion and cancer biology, but also urban and natural environment pollution, radiation, and how can all this cumulatively affect cancer. This experience has accumulated and led to the foundation of some research projects and of course of some projects with a community-oriented lens. Let's see some of them. The first research project that we attempted was a literature review on the association of between the risk of breast cancer and epigallocatechin, a phytochemical component that one can find in tea. The second research project focused on health literacy about cancer among adults in the form of a cross-sectional survey. The third research project expanded further from just trying to put together a publication. We focused on the topic of HPV-associated cancers, and we tried to combine some write-up in scientific and popular media with a number of events and dissemination of credible information in online and physical fora. A fourth project touched upon technology and how these novel technologies interface can help in the battle against cancer, and in this case we focused on AI and on psychology. Again, this was a collaboration between Greece and some research teams based in Europe, and it also combined a scientific process and write-up with community actions. The fifth project, which is on the way, is another literature review on lung cancer and ease of love wounds. One reason for this is that many members have joined in order to get familiarized with scientific writing and research methods, and through such kind of projects we can teach each other and then take back this knowledge to our normal works, our normal studies and so on, and have a better and larger impact. And a sixth project, for the same reasons, but also given the interest and the specialization of some of our members, is the fact, of course, that Greece is a country that receives a lot of radiation from sun, the impact of UVA and UVB sunlight radiation on cancer, with a focus, of course, on pathogenesis and relevant prevention. And as this conference has shown, science should be in society, and for this reason we also have social projects. One of the flagship social project, and also one that we initiated with, was the donation of Easter candles to 50 hospitalized children in Greece, in Athens, who suffer from oncological or other chronic diseases. These Easter candles may not say a lot to all of you, but this is something that we did taking into account the cultural context in which this donation was designed. And of course, to add upon this, soon after that, we worked and launched an online psychosocial and counseling support line for cancer patients, their families, and their caregivers in the native language of our country, and probably in the future in more languages, if necessary. A third project was the donation of books to teens and children. We all know that young people with cancer have a lot of needs. One of the needs that is not really covered is education or even amusement through books, and we tried to cover this. Another project was the donation of toys, again because cancer is a devastating disease for everybody, but especially for children. And when we focus to novel medicines, best treatments, and so on, we often forget the small things that make life for these patients happier. A fifth project was, again, the donation of books. This is why we are privileged or happy to have many members with a background in humanity in our organization. And this means that they don't only understand the educational needs of children, but they are also able to coordinate collaboration with publishing houses and select the books that are more suitable for these young ages. And a sixth project, which had a social character and tried to address a larger audience, was a webinar on human papillomavirus infection and cancer in the frame of the research project that we mentioned before. A seventh project was the donation of gift vouchers for shopping from supermarkets to families who have a member with cancer. Again, in collaboration with supermarket chains in Greece, because apart from novel therapies and so on, cancer is a disease that unfortunately is associated with a lot of out-of-pocket payments. And during the financial crisis, we all understand that this is an extra challenge that people suffering from cancer and their families should not go through. In the same spirit, members of the organization and their social circle were also invited to donate to social grocery stores in a municipality in Athens. And deviating from this, we have also in the meantime developed collaboration with scientific students associations like the IGEM. This is a team that prepares an experiment and a project that is pitched in a synthetic biology contest. And together with them, we delivered the webinar on lung cancer, encompassing several aspects of this, ranging from epidemiology to diagnosis and treatment. Going away from pure social actions with donations and informative actions, we also try to enhance this approach with providing access to screening. because we are talking about prevention, and screening is one of the most important tools in the field of prevention. So partnering with some medical organizations and healthcare facilities in Athens, we managed to provide 20 free digital mammograms to women between 35 and 75 on the occasion of World Breast Cancer Day. Again, this doesn't cover, of course, the need of the whole population, but this is also a way to inform people that there is this screening test, and especially in Greece, you also have the way to take this test through the public healthcare system. And what is usually not there is the knowledge, information, or the motivation that people need to take these screening tests. But on the other hand, if someone hears that their friend, their neighbor, their family member went through the screening test, probably this rings a bell, and this is a reminder or a bit of an encouragement in order to go for some screening for breast cancer or other prevalent cancers. Another social project was the delivery of a webinar focusing on first aids and the basic life support in the scope of broader health promotion in our communities. And in the same spirit, we also initiated a series of health promotion lessons in schools for high school students in Athens, with a focus of cancer, but also delving into other relevant healthcare issues. And in addition to this, given the previous background with donations to children with cancer, we were also able to donate toys again to children, but children that are hospitalized in another major Greek city, in order to extrapolate this action there and try to create some synergies in this city and potentially in more cities. An additional activity is the activity that we took up, leaving a bit aside, without forgetting, of course, the national level, is that we tried to become members of the so-called European Climate Pact. This is a project of the European Union that is arranged, that is prepared for the goal of environmental sustainability until 2030. And in this frame, the European Union has released a course of action and collaboration for a healthier environment. Now, from cancer to environment, you may say that there is a difference, but we should not forget that last August, the right to a healthy and sustainable environment was proclaimed a human right, a universal human right by the United Nations. So in this frame, we believe that it was important that we were the first health-oriented NGO in Greece, pledging for the EU Climate Pact and also trying to educate in the future people about environmental risk factors and environmentally oriented prevention of cancer. One upcoming activity that will be in the spirit is the release of a cancer prevention teaching series in Greek for the broader public in Greece that may not be familiar with the English language or the technicalities of the English language. This will also be accessible to people from Cyprus who also speak Greek as their native language. And we will try to incorporate the environmental perspective of cancer prevention there. We have, of course, regular updates of all this on our website, which you are more than welcome to visit. We try to disseminate this in the press in order to get more organizations or more people interested in what we are doing, and probably start collaborations with them, or make sure that we will be able to make more donations and more activities in the future. And this stated, I would like to, first of all, thank you all for your attention. Thank the organizing committee of the BSI for hosting us. And I do invite you all to connect with us and reach out in case you want to learn more about the organization or to collaborate with us. Thanks once more, and stay healthy.